Hello everyone, my name is Maya Rahma and I'm going to be explaining Guillan Barre syndrome. Guillan Barre syndrome, also known as GBS, is a rare autoimmune disease that affects the peripheral nervous system. People of all ages can be affected, but it is more common in adults and in males. An individual with GBS may first start to feel weakness in the limbs, facial weakness, as well as a loss of reflexes due to the immune system mistakenly attacking the peripheral nerves. More specifically, the myelin sheath, which is the protective covering of the peripheral nerves. This causes the nerves to be unable to properly transmit signals, resulting in the person losing motor functions and sensory sensation. These symptoms can range from mild weakness to severe paralysis and can increase in intensity over a period of hours, days, or weeks until certain muscles cannot be used at all. If it becomes severe, a person can be almost completely paralyzed and the disorder can become life-threatening, potentially interfering with breathing. Paralysis in GBS usually is symmetrically ascending, meaning it occurs on both sides of the body and moves upwards. The exact cause of Guillain-Barré syndrome is unknown, but it often occurs after a viral infection or bacterial infection. The most common preceding infection involves the bacterium Campylobacter jejuni, a common foodborne pathogen. It is not genetic or contagious. One explanation to GBS is molecular mimicry process. The lymphocytes and macrophages perceive the myelin sheath as foreign and attack it. T lymphocytes cooperate with B lymphocytes to produce antibodies against the person's own myelin and damage it. The antibodies, created to originally attack the antigens on the pathogen which caused the preceding infection, begin to mistakenly attack the myelin sheath due to the pathogen sharing similar components with the neuron. To check for Guillain-Barré syndrome, reflexes are checked. People with Guillain-Barré syndrome usually have no or reduced reflexes. A spinal tap is also performed. This is where a small amount of fluid is withdrawn from the spinal canal in the lower back. The fluid is then tested for a type of change that commonly occurs in people who have GBS. There is no known cure for Guillain-Barré syndrome, but two types of treatment can speed recovery and reduce the severity of the illness. The first one is immunoglobulin therapy. This is the injection of healthy antibodies to help lessen the immune system's attack on the body. Another way is plasmapheresis. A machine pumps blood out of the body, removes the cells attacking the nervous system, and returns the blood back to the body. Supportive care is very important to address the many complications of paralysis as the body recovers and damaged nerves begin to heal. As individuals begin to improve, they are usually transferred from the acute care hospital to a rehab setting. According to the National Institute of Neurological Disorders and Stroke, 70% of people with GBS eventually experience full recovery. About 15% of individuals experience long-term weakness. According to the CDC, most people recover fully from GBS, but some people still have permanent nerve damage. In rare cases, people have died of GBS, usually from difficulty with breathing. So I took the opportunity to interview my dad and his experience of Guillain-Barré syndrome. He was diagnosed with GBS when he was 17 years old. The first question I had asked was, what were your symptoms? He said it was a gradual process with no pain. Within 24 hours, he suddenly started feeling weakness in his right leg and difficulty walking. He started sneezing and later developed a severe fever. Gradually, his right leg became paralyzed and he had a loss of sensation in his left leg. Loss of sensation ascended to his chest area. So the next question I had asked was, how are you diagnosed? So at the hospital, the doctors checked for a Babinski reflex and then performed a spinal tap, where he was then diagnosed with Guillain-Barré syndrome. So my final question was, how long did it last and how was the recovery process? So he stayed in the hospital for 2 months with the GBS gradually going away on its own. Then he went to rehabilitation for a month. The total recovery period was around 3 months, yet he still suffers motor weakness in his right leg and a loss of sensation for temperature in his left leg until today. Thank you for watching my video on Guillain-Barré syndrome, and here are some references if you want to learn more.